I want to thank Jake for asking me to help co-sponsor this legislation. You know, you cannot fix a problem if you don't understand it. And, you know, I've been a pharmacist for 37 years. I've done everything you can do in pharmacy. Still have a pharmacy, retail pharmacy, compounding, sterile, non-sterile, home health, hospice, because we are an invaluable part of the healthcare system. You know, when I came to Congress, you just have to understand what it meant. I went from the most trusted profession to the least trusted profession to come to Congress to fight for something I've been advocating for the last 25 years. And as I said when I started, you cannot fix a problem if you don't understand it. And just like these independent pharmacists behind me, they understand, and I totally understand the pressures that they go under every day just to conduct business. You know, I understand the struggles that the community pharmacists face with reimbursements, with clawbacks, the DIR fees, the prior approval, the cost of drugs, the reimbursement. And pharmacy benefit managers and the outsized domineering roles they play in our drug coverage, sending people, like Jake said, sending those patients to their own pharmacies. Why would the FTC not have said that shouldn't have happened years ago? And that's the question that, sitting on E&C, that's the one thing that we've done this past year. It's taken over a year or even two to get them to look and investigate the pharmacy benefit managers and the shadowy practices and the shell games that they play with the pharmacists, with the patients, with the rebate programs. You know, they do maneuver in the shadows, and they put the financial screws to independent community pharmacies, and they often raise drug price and drug costs to patients by steering those prescription drug coverage to whatever pads their bottom line. You know, at the end of the day, you got to remember, PBMs, they don't treat a single patient, they don't cure a single disease, and they do not insure a single American. That is the bottom line. And like I said, just a couple of months back, we got the interim report, the FTC report that Representative Auchincloss was talking about. And it is detrimental to the PBM industry. You know, it shows the self-dealing, distorting competition, essentially printing their own money, and now it's well documented that there are certain medications that get marked up by thousands of dollars. And they flow toward those pharmacies that are owned by the same parent company as the PBM who sets the prices. So it's past time to do something about these entities. That's why this Pharmacists Fight Back is so important, to build on many other bipartisan PBM bills and legislation. We passed the Lower Cost, More Transparency Act. There's a lot of different PBM legislation. There's still a lot of other things we're doing. We've included oversight. We've included Ways and Means. Any committee who wants to look at the pharmacy benefit manager practices, we've included them. Comprehensive PBM reform is an absolute necessary part of lowering drug costs for patients, employers, and government programs, and it levels the playing field for independent community pharmacists. This bill will put in place much-needed reforms and federal programs to stop the gouging of independent pharmacies and make life-saving drugs more affordable for patients and implement solutions that will yield savings to the taxpayers. So I want to thank you, Jake, Rep. Auchincloss. I call these younger than me representatives by their first name. It's not a sign of disrespect. I like to be on that level. And I appreciate him for leading the bill and the many great pharmacists behind me that came out to support this. And I want you to know that we've only begun, and that's just the interim report. And when we get the conclusive report, it's going to be something they can't run and hide from.